Well, when I came here 25 years ago, I was the only hematologist in the county, and I was very driven to provide good health care. But over the years, I sort of saw my role as expanding to do education. For instance, there's a large number of people in this community who have a disease called hemochromatosis, so I did a lot of education so we can screen for it.
And what is that? I'm sorry.
It's a disease of iron overload that affects people of Northern European extraction. And sort of expanded my role to do some teaching with all the new blood thinners that have come out and helping us be consistent across the board. You may not know that this community provides the hospital with its supply of blood. Our blood comes from local donors, and that's not typical across the country, and it's a real tribute to Lebanon County. And I started a blood management program so the blood would be used wisely. And we've maintained that this hospital is completely supplied by its local donors due to our blood management program. So that is a real feather in the cap to the people of Lebanon County.
That's amazing.
Part of my practice is malignant hematologic diseases, and part of it is benign. And a big thing that I've done and very proud of in the last few years is get the Sechler Family Cancer Center started. You've been there, of course, and it is a wonderful place and a very peaceful place, and definitely is the center for cancer care in this community. I did a lot of fundraising with Jason Trout for that building, and a lot of work towards the internal quality of our cancer care in that. I think Lebanon County should be really amazed that have a cancer center like that.
I'm looking in, when I went on the tour and you took me through, there were fireplaces, and you looked outside and there was landscaping that was just massive, and there were waterfalls and flowers and bushes. I mean, just like you say, peaceful, but it's like, wow,
Right.
all the thought and time that went into making that like a haven, so when you're sick,
Right.
you're not thinking about being sick.
Right. And the amazing thing about that is the support of the community for that building, starting with Scott Sechler's amazing donation, but other people, the Yanni family putting in the lobby, the Mitzcipher family making the spiritual room where you could go and be upset and alone and get away from everything. And the infusion room is just brilliant of Bob Hoffman to design that, because basically if you've got an IV in you and you're getting an infusion, you're looking out on this beautiful landscaping and water feature that is so relaxing. And I doubt there's anybody that has an infusion room in their cancer center that is as beautiful as that.
I couldn't agree more. I mean, it just floored me when I walked in and saw the elegance and peacefulness, and the whole atmosphere was just amazing. And I know you and your staff, Kelly and all, are just terrific with people. When I would take my mother and my uncle for treatments, never once did I feel like a fifth wheel. I mean, we were included, and you made my mom and my uncle feel like they weren't sick, even though they were going through a lot.
Well, Kelly Smith is the driving force in that cancer center. She's the most phenomenal nurse I've ever worked with, and now, of course, she's the director. She was the driving force, the little engine that
could.
Yes,
Oh, that's
absolutely.
great. Pink shoelaces. Tell me about that.
Well, long time ago, must have been 6 or 7 years ago, we decided, well, what can we do for Breast Cancer Awareness Month? And I thought, well, you know, we can make signs and we can talk to the women that it's time in their life to get screening, but let's focus on their children, because they'll do this for their children. So I thought, let's have our Lebanon County athletes during the month of October wear pink shoelaces to the games so that they can speak to their mothers, their aunts, their grandmothers to get their mammograms done. And it was a big hit. And you know, I remember the first day of that month, we started out with my son's soccer team at Annville Cleona, and all those coaches also had pink shoelaces on.
That's just such a fun thing to do. And I mean, did you see it somewhere else, or did you just think of it?
I kind of just thought, what are we going to do? I mean, I thought, well, maybe they'll wear a pink ribbon, but I thought it would be really cool if we could get the boys who are playing sports, the football players, the soccer players, to wear pink shoelaces, because they're going to be husbands someday and try to remind their wives to do that. So it was a fun project.
That's forward thinking. And what's this Six Sigma Green Belt?
Six Sigma is a methodology of change. There's many such, I don't know the names of all the others. I think one is called Lean, where you learn how to create the change you want to do in a very organized fashion with data. And Kelly Smith and I got Six Sigma Green Belts a few years ago, so we could implement changes in our practice using data-driven processes that made a lot of sense.
No karate chops.
No karate chops.
If there's one thing that you would like to leave us with, that you would like us to know about you or what you do, what would that be?
I guess one of the things that I'm proud of really doesn't have to do with, being a hematologist per se. It's talking to my patients over the years about what they can do to be healthy eating, exercise, and thinking about cancer treatment also as survivorship after cancer care, which Michelle Remlinger and I have partnered with her Pink Complete program, and really talking to people about their health and what they can do to be healthy. And the other thing is as you know, it's not easy to be a wife and a mother and have a career, and I hope I've been a role model for my daughter, but also for the women that I meet, the nurses I work with, the younger physicians, the women pharmacists, because in order to do that, we can't do our careers like men. We have to do them differently. Not better, just different, in order to be successful and not give up our careers while we're raising our family. And I hope I've made an impact there.
You certainly have. Again, thank you, and God bless.